Arlene Goodwin knows all too well how hard it is to access medical records in New Zealand. Her son Luca was born with a heart defect, which meant he's had to have 3 open heart surgeries, the first when he was just 4 days old. Now she's launching an app to give people secure personal control of their health information. And she is joining us now. Arlene, good morning.
Good morning.
AI Health.
Yeah, My Health.
Oh, My Health.
My Health, yeah. So it's a little play on words. We have got closed circuit AI to facilitate people retrieving their records from within the app.
Tell us about Luca and take us back to the very start. What sort of condition does he have?
So he is hypoplastic right. So he was born with effectively half a heart, so he couldn't oxygenate his blood. Together with a whole lot of other complications. So we found out in utero, my husband and I, and had the option not to continue with the pregnancy, but we continued, and he was born and operated on by an amazing surgeon in New Zealand, Kirsten Finucane, within sort of 4 days. And then he had a second surgery at 4 months, and unfortunately after that surgery suffered medical misadventure in post-operative care and had a stroke. Okay. And that sort of took out 2/3 of the left brain function. So, prognosis, he'll never walk, he'll never talk. So as a result of that, I didn't return to work, and, basically we just spent all our time the last 10 years doing his rehab and medical care. He had a third surgery, which was successful at 3 years. And then in 2020, just before he turned 5, we moved to the US. And he had a massive surgery over there as well.
Really? Did you move for surgery?
No.
That was unrelated?
Unrelated. We moved with my husband's job. And, one of the key criteria was making sure that we could access insurance to get cover in the US. So their system's amazing, but you need insurance cover. So, the bank had my husband worked for a bank, and the bank had amazing insurance cover. So thankfully, because he developed, as a result of the damage that was caused from the stroke, he ended up developing a condition called ESCS, which is elliptical status seizures and sleep. And so he needed to have a hemispherectomy where they disconnected the whole left side of his brain in 2024. And then he and I lived in a rehabilitation hospital in New Jersey while my husband was based in New York. So
wow.
For 3 months. So yeah, we've lived the real pointy end of the stick in terms of the medical journey.
You have
across multiple jurisdictions.
How's Luca today?
Look, he's amazing. He's a teacher in grit and resilience. He never complains. He's got a great sense of humour, and his whole body has just flicked to the opposite side of his brain, and he's got challenges, but he's a delight. So he holds the whole family together. He's amazing.
You're proud of him?
Be careful, I'll start crying. Yeah, of course. Yeah, no, he's incredibly resilient.
And he's, I think, probably very proud of you because you've held it all together and you've battled through, and I do mean battled through health systems, because that's what it's like for mums.
Yeah.
Tell us about that experience, and that's what's led to the app.
Sure. So I think, the doctors and nurses within the healthcare system are phenomenal. Like, I think in New Zealand we have top-level health professionals. The issue that we have is that there is no central data repository to share information. And as a result of that, information just gets lost. So, what is with your GP is not in line with what's with your specialist, is not in line with the hospital. So everyone, I think, assumes falsely that everything goes back to the GP. It should, but it just doesn't. Blood tests get sent by like a specialist. You see a specialist in private care or at the hospital. They don't go back to the GP. Medications come from a specialist. They don't go back to the GP. And something that still completely astounds me is that the DHBs have no ability to access one another's systems
insane.
It's insane for a country of 5.5 million people. So we had that experience in Queenstown. We had taken Luca to we had a family wedding and we'd gone down to, this is, when he was quite little, and he had a seizure. We ended up at Queenstown Lakes. It was too complicated, so they sent us to the Southern District Health Board in Invercargill. And time was really critical, and they were asking me for the contact details for his cardiologist and neurologist in Auckland. Now, thankfully, I'm a bit of an Uber geek, so I had a big folder. I literally carried around a massive A4 binder. And
everywhere?
Everywhere, if we were out of Auckland.
Yeah.
And a lot of it is kept in my head though as well. So that tension was there. I was very aware of it. And then we moved to the States, and it's the same challenges but in a very different way. Their system is controlled by the pharmaceutical companies and the insurers. And so they try to get you end to end within one framework, one particular network of doctors from GP all the way through to surgeons. And so, they make that information process streamlined. But then no one does that. You follow the best doctor. And so when I was in the States for Luca, I was running 7 apps, and there's no sharing.
No.
So the doctors are relying on me to tell them what's going on with him.
So this is where your app comes in.
Yep.
So your app, you can take cross jurisdictions,
Yep.
cross regions,
Yep.
cross hospitals, cross doctors, and it keeps all of the health information in one place.
Yes, it essentially gives. So we flick the narrative on its head. I think the health sector globally is aware of the issue, but they are constrained by privacy because they are dealing with individual health data, health data pertaining to individuals. We own our own personal health information and we can do with it as we like. So we are entitled to all health information created on us globally. I think most people either don't realise that or they just have nowhere to put it securely. So we have created this app, which is HIPAA and GDPR privacy level, highest privacy level compliant. It's encrypted. It's got everything to give you utmost security. We are not geographically locked, so you can take your information from anywhere in the world and you can securely store it. But more importantly, the closed circuit AI we've built, because you think about the volume of information that all of us have, particularly as you get older like myself, the closed circuit AI allows you to find it. So you don't have to remember who did what.
Look, it's a brilliant idea. It's a brilliant idea, and I'm sorry that you had to think of it.
Yeah.
But I'm glad that you have.
No, thank you very much.
Is Luca watching this morning? How old's Luca now?
He's 11.
11.
No, he's at school.
Oh, he's at school. I was going to say, Luca, once you get to teenage years, you will hate this woman, but you shouldn't. You've been an amazing mum.
Thank you
for coming on the show this morning. And just to clarify, it's Arlene Goodwin from My Health, which is MAI.
Yes, thank you.
Brilliant. Arlene, nice to see you. Thank you.
Thank you.